Hello, Nation. Today we're going to talk about the Diabetes Warranty Program, something we've been talking about since the very first conference in 1995. Now, why am I wearing an eye patch? Because I had an issue today with my eye when I went to the eye doctor, and I'm going to tell you about that in a second. And that's why I'm a little bummed out today, to be honest. Now, one thing we always talk about are the three global issues of diabetes. Prevention, let's prevent diabetes in the first place and its complications. The second is early detection of diabetes and the complications of diabetes. And that's what the Diabetes Warranty Program is all about. And then once you detect a complication or diabetes, it's aggressive therapy. And that is key. And we're going to talk about the Diabetes Warranty Program. Now, it's all about picking up complications early, because guess what? Many of these complications have no signs or symptoms in the early stage. Any condition that doesn't have signs or symptoms, you have to do screening. So we're going to talk about the eyes, kidneys, nerves, heart, and then teeth and gums. So the first thing is the eyes. I've been preaching for years. Get a yearly dilated eye exam from a diabetes eye specialist every year. So guess what? One of my patients who sees my eye doctor comes and sees me at a Christmas party and says, "Hey, Dr. Tordambi said, hey, you haven't been in well over a year. You need to get in there." So I made an appointment. I realized that I had not been there for 2 years. In fact, a little over 2 years. And I noticed I had a problem with my vision, but it wasn't that much of a big deal. And then he looks at my eyes, dilates it up, and says, "Steve, you got diabetic macular edema, and we got to do something today." So he got out a special medication, and he injected it right in my eyeball, a little anesthesia. He did a great job, and I'm going to have monthly injections for 3 months to see if this macular edema gets better. So I want to urge you all that everyone watching the show with diabetes needs to get a yearly dilated eye exam. I've been saying it for 22 years, and I messed up. And I'm actually paying the price for that right now. Now, what about kidney function? Get a yearly test of your kidneys. You don't have to remember fancy words like microalbumin, creatinine clearance. Just tell your doctor. They measure the protein in your urine. This is extremely important because there are no signs or symptoms of early kidney disease, just like eye disease. You've got to be screening. Now, if you do collect your urine, make sure you label it correctly when you put it in the fridge because you got to keep it cold. Now, what about your feet? Follow some very simple foot care rules, like don't walk on a hotbed of coals. And this whole thing about daily inspection, that's important only if you have neuropathy. If you have big, thick fungus nails, do not do bathroom surgery. And these are the kind of feet you need to look out for. If you're someone who can feel everything on the bottom of your feet, you step on a little pebble, it hurts, we're not worried about you. We're worried about people who are, quote unquote, insensate. They step on a nail, they don't know it, it gets infected, and then they get into some serious trouble. I can just tell you, I take extremely good care of my feet. I have no issues there. Now, what about the heart? People with diabetes, especially type 2, have a higher risk of heart disease. So we follow the ABCs. Now, the ABCs of the heart is aspirin, blood pressure, and cholesterol. I don't have enough time today to tell you about all the intricate levels and medications. That's different Edelman reports. But every person with diabetes, especially type 2, has to know what their goals are, talk to their doctor, and make sure that they're a candidate for aspirin and that their blood pressure and cholesterol is under control. Now, the last thing is tooth and gum disease. It's extremely important. Our gums are very good indicators of inflammation, and that can be very important when we talk about heart disease as well. Here are my recommendations. First of all, you want to brush your teeth twice a day. It's extremely important when you wake up and when you go to bed. You should floss once a day because that helps get off the plaque. And my bottom line recommendations, brush your teeth twice a day, floss once a day, at least 1 week before and after you go to the dentist. Now, if you don't, you might end up with teeth that look just like this. So long, nation.